Adamawa gets attention now as residents of that state community, mostly pregnant women and nursing mothers, have lauded the United Nations International Children Fund, UNICEF, and the European Union, EU, for their giant strides in reducing maternal and child mortality. The residents say maternal and child deaths have drastically reduced in the area in the last few years, adding that this was achieved through the initiative of UNICEF and the EU Maternal, Newborn, Child Health and Nutrition Project. Correspondent Hebron Giwa sent in this report.
These women could not hide their joy, as they say the intervention of UNICEF and the EU has helped in improving the quality of health services and strengthen community structures that increase the demand for health and nutrition services. The women in the community say the decline is as a result of the increase in the proportion of poor, marginalized rural women and children accessing high-impact health and nutrition intervention. They are contented with the intervention because it has gone a long way in bringing the community women together and taking drastic measures toward going to antenatal care and immunizing their children often. The women are appreciative of UNICEF and EU for improving their health status, specifically pregnant and nursing mothers.
Very good, because it makes children healthy. They are not, if they are taking immunization, no sickness. So it's helping children a lot. So we are really grateful for the assistance they are receiving from UNICEF.
UNICEF is very, they are playing a vital role about the immunization. They bring the immunization for the help of our children. So the immunization will help our children to protect us from diseases.
We are very much satisfied with the intervention of UNICEF and EU in our community. Pregnant women can now go to any clinic for the routine antenatal. Nursing mothers can also give their children immunization. All these are for free. At least our community can have access to free drugs, and our children and pregnant women are very much healthy now. Some of the health workers say the intervention by UNICEF and EU to the community has reduced the deaths of pregnant women. Meanwhile, the number of deaths among children has equally continued to decline.
UNICEF, they are trying their best because they used to supply us drugs, cough drugs, Ferros, SP, then RBT, and some of them.
Immunization for children from 0 to 11 months. We are doing OPV, Penta, TCV, and measles and yellow fever.
Very big thanks to the UNICEF for the donation of vaccines that they were doing and all the effort that they have been putting on to see that all our children have been immunized.
With this intervention, it is believed that the issue of maternal and neonatal mortality would be a thing of the past in no distant time in Adamawa State.
You're watching the news on Galaxy TV.